Hello everyone, I'm Adeoye Olufunke from Pharmacostory Health Awareness Initiative. Pharmacostory Health Awareness Initiative is a non-governmental organization of public health students whose aim is to curb ignorance about diseases, drug use and drug misuse globally. Now, this initiative sets out to create a society of well-informed citizens ranging from children to the youths and to the elderly.
Hey, it's World AIDS Day, so today we'll be talking on the misconceptions of HIV/AIDS. My name is Aulola Timileyin Omolayo from Pharmacostory Health Awareness Initiative. One of the misconceptions of HIV/AIDS is that HIV is a death sentence. Actually, with early detection, proper treatment and adherence to medication, HIV patients can actually live a normal lifespan. Another misconception is that you can easily identify HIV patients by mere looking at them. Well, the visible symptoms of HIV, such as weight loss, is usually evident on the long run, which is why everyone, whether you are looking good or not, should know their HIV status. Another popular belief about HIV/AIDS is that HIV patients cannot safely have children. I put it to you that if pregnant women living with HIV work closely with their healthcare provider such that they start their antiretroviral therapy as early as possible, this would help to reduce to the barest minimum the chances of transmitting HIV to their children, of which cases have been recorded of pregnant women living with HIV having children without HIV. To the misconceptions earlier stated, it is often thought of that HIV will always lead to AIDS. HIV is the infection that causes AIDS, but does not mean that every HIV infected patient will have AIDS. AIDS can be prevented by early detection and early treatment of the HIV infection. With current therapies, the level of HIV infection can be controlled and be kept as low as
HIV cannot be contracted by coughing, sneezing, hugging, touching, sharing eating utensils, or sharing food with an infected person, because the virus cannot survive outside the body. But the virus can be transmitted from person to person if infected body fluid such as blood, semen, anal or vaginal secretion, and breast milk get into the body of an uninfected person through the following ways: unprotected sex, mother to child transmission in childbirth, pregnancy, or breastfeeding. Also through infected needles and through infected blood donations or organ transplants. Thank you. My name is Eunice Oyesiji from Pharmacostory Health Awareness Initiative. Thank you.
Now, you know that HIV is not a death sentence. Being skinny does not necessarily mean you have HIV. HIV does not always lead to AIDS. Pregnant women living with HIV can safely have children. The ways in which HIV can be transmitted and the ways in which it cannot be transmitted. Now, I have a question for you. Do you know your HIV status?